Good morning and afternoon, everybody. I'm Cain, Executive Director here at CPWR, the Center for Construction Research and Training. I'm happy to welcome everyone to today's webinar on responding to COVID on the job site, news from the Oregon COVID-19 Joint Construction Safety Task Force. As most of you probably know by now, CPWR and I are holding this bi-monthly COVID-19 webinar series for the construction industry. You can access recordings from the whole series through a playlist on our YouTube channel. Early in the COVID-19 pandemic, construction stakeholders in Oregon formed a task force to find a way to prevent the spread of the disease on job sites, protect the workforce, and keep the building and construction industry operating. Today, you'll hear from representatives about their collaboration, lessons learned, and best practices identified. Our panelists include Robert Camarillo, Executive Secretary of the Oregon State Building and Construction Trades Council; Avery Foster, Occupational Health Consultant with Oregon OSHA Consultative Services; and Dee Dee Montgomery, Senior Research Associate, Outreach and Education at the Oregon Institute of Occupational Health Sciences, OHSU Oregon Healthy Workforce Center; Wayne Chow, Political and Senior and Special Projects Coordinator with the Oregon State Building Trades Council, is also on the line and available for Q&A at the end. My counterpart at NIOSH, Dr. Scott Ernest, Associate Director for Construction in NIOSH's Office of Construction Safety and Health, will be moderating today's webinar, including the question and answer session. Scott, thanks for joining us, and I will kick it over to you to get us started.
Okay, thanks, Chris. It's great to be with everybody today. I just wanted to give a few updates from CDC NIOSH. First thing I wanted to do is just give a few things related to cases and fatalities. There have been approximately 6.8 million cases in the U.S. There have been 200,275 deaths. And in the last 7 days, there have been approximately 302,000 cases that have occurred. In terms of the CDC website, there have been a number of new guidance documents that have been posted that may be of interest. There's an update to a guidance document called Guidance for Reopening Buildings After Prolonged Shutdown or Reduced Operation. That information had been updated to include details on lead and copper in building water systems with low or no use. It also included information about mold awareness, monitoring, and remediation, and an update on guidance related to dealing with Legionella. I also wanted to mention on the CDC website, there was an update to a document called 10 Things You Can Do to Manage Your COVID-19 Symptoms at Home. And then two new subjects, one related holiday celebrations as we're moving into holiday season over the next 3-4 months or so, and then an update on frequently asked questions for wildland firefighters and COVID. So I just wanted to give that brief update and then turn it over to Robert so he can begin the presentation from Oregon. Robert?
All right. Thank you, Scott. We didn't, when we started this task force a few months back, I didn't realize that there would be this much interest from outside the state. And so it's great to be here. It's great that we've started something that there's a lot of interest, not only from in the state, but out as well as other places around the country. So thank you, Scott, and thank you, Chris Trahan, Cain, Executive Director, CPWR. Thank you for allowing us this platform to share a little bit about the work that we've been doing here in Oregon to try to keep not only our members safe in the building trades, but the entire industry. It's pretty common that we work next to unrepresented workers. So this is something that I think all workers have benefited from and will continue to benefit. I know we don't have a lot of time, but it wouldn't be right if I didn't recognize some of our stakeholders. And I'm not going to get to everybody, and so I apologize in advance if I miss you. But this really wouldn't be possible with the support and the partnership of some really important people. Not only all the business managers that are part of the Oregon State Building Trades Council, all the local unions, all the business agents, all the assistant business managers who participated and continue to participate, and the business managers who have actually been part of the task force, who have been on the job site visits, who have been involved every step of the way. So thank you all. And again, there is one individual that I'd like to really point out, and that's Terry Watson with OSHA. She's probably the first person that I went to with this idea to see if we can get some support. And that's really what got us rolling is we collaborated and we started to identify some folks that we could reach out to. And so thank you, Terry. I know you're recovering, and so I just want to, recognize you, and as well, and Dan Drinkwood of Hoffman Construction. He's another one who I was in close contact as this we started to deal with this pandemic. So thanks to Dan and his team over at Hoffman, Cordell Tights with Charter Mechanical, Mike Salzgiver at the AGC and his team for always being involved. I think, Mike has made sure that he has some representation on every job site visit that we've gone. They are at every meeting. So thank you, Mike, for your participation and commitment. Mark Long and his team at OHBA, Kelly Kupsak and Marianne Naylor at Oregon Tradeswomen for all the work they've done around the media, the press releases, and working with us. Sometimes it's been difficult working with this many groups and these umbrella organizations that they're busy, and so thanks to them, and also to our political coordinator Wayne Chow. He's been very key in all of this behind the scenes. So thank you, Wayne. Matt Swanson, the Carpenters, again, always making sure there's some representation at the meetings or on the job sites, whatever it is. And so without their participation and commitment, this thing doesn't happen, and we don't move it the way we want it to. Jen Hess, Lena Stepik over at Oregon Lurk, thank you all. And again, there's just a number of umbrella organizations who have jumped on and have been a part of it. Those are some folks that I really wanted to recognize for their work early on. And yeah, without them, this collaboration doesn't exist and doesn't happen. So for some of you folks that may not be familiar who the Oregon State Building Trades Council is, we're an umbrella organization made up of 32 affiliates. We're an umbrella organization made up of over 32 affiliates. We have tens of thousands of workers throughout the state of Oregon. The building trades is the political arm of the trades here in Oregon. We have 6 regional councils. We have leadership in each one of those councils who do a good job of making sure we stay connected, that there's some communication between the state and the local politics, and just making sure that we're communicating. The building trades was created over 80 years ago to help give building and construction trades workers a voice in the Oregon legislature. And that's something that we focused on and something that we continue to do. And I know a lot of us who have come to work on this project may have not always aligned and had, we've seen some differences. But I think this really shows that we have a lot more in common than what we may think we do. We all put our differences aside and we came together, and so that's something that I'm excited about, looking forward to, and working with all the stakeholders and trying to find some alignment on legislation that will benefit and keep workers safe as we continue to build throughout the state of Oregon. And I'm going to move on, go into the timeline a little bit. So just to recap how this all was created. So back around late February, the Oregon Health Authority reported its first COVID case in Washington County. I think everybody was, pretty hopeful. Okay, that's going to get under control. Not a big we're not going to hit the panic button yet. Well, things just started to get worse. We started to hear more reports. People started to get a little nervous. And around March 23rd is when the governor issued the first the executive order 2012, Stay Home, Save Lives. And I think that put our industry into kind of panic mode. I think, it was new for a lot of us. We weren't sure how to respond to something like that. And so there was a lot of uncertainty in the conversations that I was having with my executive board, the business managers that are in the building trades, and some of our industry partners, some of the general contractors that we work with. And we really wanted to make sure that we, did everything we could to keep the job site safe, keep the workers safe, but also continue to keep the industry moving. We do consider ourselves as essential workers. We are the ones who we're going to keep the electricity, the water, and everything else going in these hospitals, and keeping the highways clear, keeping, making sure that the highways were clear for first responders, and and a number of other situations. So we wanted to make sure that our folks stayed working. So when that executive order was issued, we knew that it was probably going to be a matter of weeks that we would start to see, different industries shutting down. And we thought, well, we need to do something. We need to, have another set of eyes out there. And again, started to reach out to folks in the industry. And it just made sense to put a group of stakeholders together and, put our thoughts and minds and all our experiences together and see what we could do. And we collaborated, and around March or April, early April, we had our first meeting. 2 weeks later, we visited our first job sites, and then we began collecting. We continued to visit job sites and collecting data for the next several months. In June, as our task force grew, we brought on other folks with different skill sets, and which eventually led to a website that was created for us by one of our partners, and that seemed to really be kind of taking us to another level. I think that allowed us to get this information out there a lot quicker and a lot easier. As we were visiting jobs, people were asking questions. Hey, where can we go? Where can we find this and that? And so just being able to direct them to the website made a huge difference. And some of my partners here will be talking about some of those resources, so I don't want to spend too much time on that, but we have managed to gather quite a few resources for contractors and workers to use and to go to this website and find some of the best practices that we've found. I mean, we've covered the entire state, and we're not done. We're still visiting job sites, and so we expect that's going to continue to grow the list of resources. And it just started to give workers, we started to see workers we started to see more confidence in them. That fear started to kind of dissolve, and they started to learn to cope with these new ways of safety on the job and these new safety precautions on the job. So, it's been, again, without the collaboration, this thing doesn't happen. And I'm going to go ahead and pass it on to Avery Foster.
Hi, my name is Avery Foster. Oh, thanks, Robert, by the way. Appreciate all your insight. I'm a health consultant with Oregon OSHA. So I know there are people from all over the state. So I say that we typically are free and confidential, and that just has to do with some jurisdictional things with public entities. But so, for instance, with construction, we've been asked to a lot of different sites to work with employers. We're not enforcement. So Oregon OSHA's role in the task force was specifically not enforcement, but consultation. And we were there just to collaborate with the task force. I think this helped the contractors a little bit more to have OSHA on site because it was consultation. And a lot of the contractors had already reached out to consultation in the past and understood our roles. So this is what one of our site visits looks like. We all maintain 6 feet while going out on site. And you can see in the bottom picture that we didn't have face masks originally. This was a evolving hazard, so we were also evolving as a task force. So when we did site visits, we were there to identify issues, but we were also there to identify better practices. For the next few minutes, I'm going to address how we collected data and the data we collected and some of the obstacles that the contractors were facing. So originally in April, we had a lot of resources that came out to help minimize exposure in construction. And if you remember at the time, well, for people that live in Oregon, Oregon was only allowing essential employees and construction. Further, the governor's orders basically only stated that they could work as long as they maintained 6-foot distances or wore a mask. So it was very little instruction for the construction industry. So to help minimize the risk, there were a number of associations that came out and put out some guidelines. Oregon Home Builders Association put out some guidelines. Oregon State Building Construction Trades Council, Associated General Contractors, they all came out with different guidelines. And also, of course, the CDC had some guidelines. So we took all of the guidelines that we could find because they all had valuable information, and we made a master checklist or guidance for contractors to follow. We took the recommendations and merged them together, and this is what created our checklist. So this is just a few of the questions from what ends up being an 8-page document. The employers would fill this out and they'd give it back to us, and then we would record the data anonymously. Additionally, we did site visits to identify other ways the contractors were reducing exposure and hopefully share the solutions with other contractors. We also wanted to be able to identify, there's another set of questions. We also want to be able to share basic information with the press on how the construction industry were staying safe while working in the midst of COVID-19. So when I originally called to schedule the site visits, the general contractors would immediately express obstacles they were trying to overcome. These obstacles were things like they couldn't find or keep hand sanitizer. It was hard to get hand washing stations because hand washing stations were being used everywhere as, right when COVID-19 hit. Staircases ended up being a hot commodity, and they were really hard to get. A lot of contractors expressed that they didn't have the resources or the money for additional safety measures because they did the job pre-COVID-19. They had to start training employees when employees didn't even believe that this was a hazard. Some of the contractors stopped work initially to figure out how to deal with the hazard, and then their workers felt like they still had to work. So some of them went to other states and other contractors that had no protocols in place, creating a larger potential for COVID-19 on their site, on the site that was trying to be safe. They had to figure out how to completely restructure things they did throughout the typical day, such as tailgate meetings, looking at plans, trade stacking, actual jobs themselves that would require employees closer than 6 feet, where there was a potential for injury as well. So contractors are literally faced with a hazard that could shut them down, and they had to update and change their processes daily. But luckily, contractors and construction workers can be some of the most innovative people, and they came up with some awesome solutions. Some of these solutions morphed into our better practices. And here's an example of some of these solutions. As I mentioned, there was a hard time finding and keeping sanitizers. So some of the sites would lock up their sanitizers like you see here or build a box around them. Other sites would have sanitizers in their pockets. They just came up with different ways to mitigate the fact that sanitizers would go missing. They also found new resources for sanitizers, like distilleries and mom and pop shops that would have sanitizers in stock, and no one would know about them. So that was part of the information the task force could share. When a contractor would tell us, we could tell other contractors. When the contractors started doubling up on stairs, smaller contractors couldn't get them. So the smaller contractors created new temporary but reusable stair systems, completely new systems, or systems that weren't in place before in Oregon. They had to figure out ways to look at plans, like putting them on the big screen or in a giant box so they could distance while discussing the plans. Some contractors use a plan sharing software on iPads. A lot of the contractors eliminated almost all the jobs that required 2 people, and they did it in so many different ways. And then separating the meetings was a big one. A lot of contractors would either separate the meetings out into smaller groups so they could be distanced, or they'd sometimes have giant meetings, but in football fields using megaphones so that they could still socially distance. Excuse me, physically distance. Then after many weeks, more obstacles started popping up. There was an obstacle of complacency. On a lot of the sites, the employers started mentioning that the employees were bored of a continual pounding of the same message over and over again. So I put down some of the examples that we saw on site to help mitigate the complacency. Some sites made safety shirts and hard hat stickers with the message, "Be smart, stay 6 feet apart," just so it's always in their face. There was one site, well, a few sites actually, came up with some foolproof ways so employees had to stay away from each other, had to stay within 6 feet. So that's, for instance, that stairwell picture. One employer made an effort to show data weekly with the cases and the deaths and discuss the other outcomes that were coming up, not just the deaths. And then, of course, some employers put their signs everywhere, including the bathrooms, and that's the picture on the right. And they also did it in multiple languages. Other things we saw. So the picture on the left upper side is one of the meetings, the tailgate meetings, where everyone could be distanced but still be together. We also saw barriers being put up initially, and that was absolutely appropriate initially, and that just ways for them to work right next to each other without having any, without having less of a hazard, or without less of a hazard. So one thing we noticed, every contractor we spoke to had controls to reduce COVID-19, but they still wanted to know what other contractors were doing. They still wanted to try to do better. They didn't want to continually reinvent the wheel either. So that's where I think the website is a valuable resource, where we've collected all the information and put it on that site so that people can look at it and see what kind of administrative, what kind of engineering controls, whatever kind of controls that other people have used that may be applicable to their site. So Dee Dee is going to go a little bit more into details about that site with you. Thank you. Oh, I forgot. One more slide. Where did we go? As Robert mentioned, we went everywhere. We did some schools, residential structures, road infrastructure, hospital stadiums, power plants, data centers. We went all over the state. we still, again, like Robert mentioned, we still have some work to do. However, we've really tried to go to every site that will allow us to go on site. Okay, and I'm going to go ahead and turn the time over to Dee Dee.
Thank you, Avery. This is Dee Dee Montgomery. Thank you both, Avery and Robert. I'm so pleased to have been kind of pulled into this project. And again, I'm with the Oregon Institute of Occupational Health Sciences. We're a research institute based at OHSU, Oregon Health and Science University. We also house the Oregon Healthy Workforce Center, which some of you may know is a total worker health center of excellence. And I really want to kind of, next slide, please. I really want to talk about two main things here. First, and I'm going to follow up on really what both Robert and Avery have talked about, which is this power of collaboration. For example, I wasn't going to mention Terry Watson, but she was mentioned earlier. And so the Institute was really pleased as an academic center to join in on this, joining our partners at the University of Oregon's Labor Education Research Center, LERC, who was already involved in the project earlier. Terry texted me literally one day and said, Dee Dee, I think there's a role for you all. And that's how things work really in Oregon. And so we are very used to collaborating in safety and health. And part of it, I think, is because we're a small state. We also, many of us have spent our careers working in the Pacific Northwest, and we have probably previously worked for a different partner. So we understand, while we may not agree on all of the basic specific needs or points, we understand where each other are coming from. And while we may not always agree, we are all really there with the same mission of protecting safety and health of workers within Oregon and really beyond Oregon, certainly beyond our state boundaries. And I just can't say that enough. We're used to working on other things. Many of us already have been working on things related to safety and health. So if we go on to the next slide, please. You saw logos for some of these organizations earlier, but on our website, you'll see the list, and we'll continue to update this as needed. So I hope that this is most recent. But what we really see now is what each of our task force members bring. And that's the other piece about partnering, is the benefits and opportunities that different partners bring. And so already we've heard from Robert that the power of labor, right, and the associations that bring members and bring member connections. We've heard from Oregon OSHA, from Avery, so really that power or the strength and the technical knowledge of Oregon OSHA consultation. And then, of course, adding the academic center, which sometimes brings also more trust as an objective viewpoint, looking at the science of things.
Yeah, I think you're cutting out a little bit.
Oh, I'm sorry. Okay. Please let me know if that happens again. I would also add, though, as you can see on the slide, we also are able to connect with those smaller organizations, the smaller contractors, the smaller owners who may not on their own have the technical expertise or the resources to know either how to do something or what to do. And I think Avery's examples were terrific on this. So that we have, for example, Hoffman, we have the larger prime contractors who are able to bring the smaller ones along. And that's kind of helpful in spreading our message. Let's go ahead and go to the next slide, please. So as Avery alluded to, one of the things we all know is that we may all have practices and SOPs out there, but if we can't share them, it really minimizes how much others can learn from those. And so when I was connected originally with our institute, the point was, Dee Dee, I think you can do a website really quick, right? And get it out there and have control over updating it. And sometimes it's as simple as that. Yes, I could do it within a couple hours. And so we were really pleased to be able to provide that. It comes with some limitations. So some of you know, for example, this is I'll show you a few screenshots, trying to keep it pretty high level of our website. But what you can see, unfortunately, is that the link is very long, as is commonly true for those of us that work in certain organizations. And so I would share there is certainly a shorter link. I know also that in a search engine, you can simply search, COVID Construction Task Force. Rather than OHSU, you could put in Oregon, and it really will likely pop up as well. So this is our way to disseminate and to keep it up to date, which is really important too, because if we can't keep our websites updated, that's a huge challenge. So let's go to the next slide, please. Midway in that home page, and again, we didn't want to create something too cumbersome. So what you see is a pretty simple design of really different topics that are set up through kind of basic bullets that will be drop downs. And for all of the practices, including some of the ones that Avery just shared, you'll notice the updated 919. I absolutely make sure to update it as soon as we have new practices, and you'll see an example of that. The other two pieces I want to point out on this page is that there is a PDF download that's also updated, because we know not everyone has access to the website. So in fact, if you wanted to print out a PDF knowing it's updated of all of those bullets and all of their details, you can do that. The last piece on this slide is to notice this was our most recent addition. Thank you to the team coming up with this. Are some low-cost ideas. And it's not an exhaustive list, but it is, certainly helpful. Finally, on this page, I should point out, it started out saying best practices, but I've kind of followed certainly how we really know these to be better practices. This topic and our work in the pandemic is evolving, and so we are not yet at best practices, but we're certainly in better practices and innovations. Final slide. These are a few examples that you would find under administrative practices. When I add things now, they're dated, so you know if they're newer. And again, you'll certainly see the suggestion that we have someone in each crew ensuring that physical distancing is maintained. And that is in fact certainly an element in some of the states that are either developing, working on rules for COVID-19 or have them in place. Thank you. Next slide. I think this is my final slide, and we did not want this to be too cumbersome, but at the bottom of the page there are links to what feels most relevant, certainly to workforce work sites in Oregon. So I'll point out the fairly new American Industrial Hygiene focus on construction safety. Although it's not developed specifically in Oregon, it's detailed and complete and an additional useful resource. And you'll see some other links on there. So I appreciate the opportunity to share and always looking forward to new things we can do to make this better. Thank you. We're ready to move on.
Okay, great. Very good. Thank you, Dee Dee. We appreciate that update. Thank you to Avery, and thank you to Robert. And with that, we'll go ahead and jump into some of the questions. And we've got a number of questions that came in through the registration as well as live ones through the chat. So I'll start with some of the ones that came in through the registration. And actually, this first question is, I think, for Dee Dee. It says, it seems that COVID transmission from worker to worker on construction sites are much less than other work environments. Are you aware of any data on this?
Thanks, that's a great question. And I would doubt our state is that different than other states. In early June, our Oregon Health Authority really began doing weekly reporting on work outbreaks. And it was basically 5 or more. And if you look through all those weekly outbreaks, you will see very fewer construction. There are challenges in construction because we have workers moving from one site to another, as Avery shared. But really, more of the outbreaks that have shown up in our state have been either congregate living, so staff working in senior living, agriculture, well, and then indoor facilities where people are working close together. It's not exclusively, but that is certainly where more of our outbreaks. And so certainly construction has the benefit of often being outdoors, and perhaps maybe more opportunities to be physically distant. And there were some great things. Add, if I can, to this question. Those of us in total worker health research and circles really see COVID-19 as such an example, probably the biggest example we right now have of how work affects life and life affects work. And I think that's been a challenge for employers, because what we know is that most outbreaks that I'm aware of, and I'm not an expert on this, but what I know of, they are bringing, it's a community or a personal family exposure that's coming to work. And it doesn't mean that it doesn't impact work, because it impacts work. And that's really a huge challenge. So I don't know if anyone wants to add to what I've said, but that would be my answer to that question. Thank you.
Thank you, Dee Dee. Great answer. Any other thoughts on that from other panelists? Also want to mention that Wayne. Oh, go ahead. Sure. Yep.
I just wanted to add, Dee Dee, I think that is true what you described about the construction industry being outdoors and having a little bit more room to separate when they are on the job site. That's not always the case. I think that might be the perception from just, the public. We actually do a lot of work indoors, and there was probably half of the sites that we visited was indoor work. And that's really what concerned us the most, was the work that's happening in the data centers, that's happening at some of the existing facilities that we have folks doing renovations in or upgrades, whatever it may be. But there is a lot of work, and that's really what concerned us. So not all the work is outdoors, and I want people to understand that we do work in a lot of indoor facilities, and it's not just the outdoor work that most people think that we're building from the ground up. There's actually high percentage of our work is done indoors.
Very good. Thank you, Robert. Appreciate that. Next question. I think this is probably one for Avery. If one employee results in a positive test and he's working with a partner, does the partner need to be sent for testing as well? And does an employer need to place all positive results on the OSHA 300 log? What do you think about that, Avery?
Okay, so I actually verified this with enforcement, with an enforcement manager in Eugene, as well as with our technical in Salem. And this isn't an actual Oregon OSHA jurisdictional, in our jurisdiction. You need to go through whoever's doing the contact tracing. Here in Oregon, it's county, and the county contact tracing will determine if the source of the illness is work-related, and if someone should get tested. You can also have a company policy that's stricter than that, but you can't make it a condition of employment. As for, does an employer need to place all positive results on the 300 log? It depends what the contract tracing determines. If it's technically this is considered a serious illness. So if it does occur, if they get it at work, and it's determined to be work-related, then it would need to be put on the OSHA 300 logs. Even if there's not time off, or even if there's you're not going to the hospital, it still needs to be put on the 300 logs if it's determined to come from work.
Okay, thank you, Avery. Appreciate that answer. Let's go to the next question. Again, this was through the registration, and it says, I think the most sustainable way of practicing occupational medicine is to prevent injury and illness at the job site. Employers should have an occupational medicine doctor at the site working along with the industrial hygienist. Do you agree?
I think this question is fascinating. As most sites I've been to don't have an industrial hygienist, and it's usually someone that wears every hat imaginable, from environmental emissions to health and safety. Usually that's kind of the person that's on site that's dealing with this. In an ideal world, of course, we'd have more of a partnership with occupational medicine. In fact, some of our VPP sites in Oregon do have occupational doctors that they're working with. They're not on site, but they're working very closely with these doctors and to help reduce all exposures. So I think in an ideal world, you would be working with an occupational doctor.
Can I jump in? Can I jump in on that? I would just follow up with Avery. I don't think, on most of our sites there's an industrial hygienist that's there. I mean, there's an industrial hygienist overseeing many jobs, perhaps, and similarly with an occupational physician. I think that shows, again, why the SOPs and the practices are so important, that they're reviewed by those and that, in fact, they're followed on the site. And that would just be my addition to that. Looks like Robert might want to say something, too.
Robert, did you have anything? Looks like you're muted right now.
No, I don't. Thank you, Scott. No, Dee, I was agreeing.
Okay, thank you very much. We'll go ahead and move to the next question. This is one, specific for Oregon and out west in general, but how did the industry handle the air quality issues related to the forest fires?
I'll go ahead and start that one. I think Avery will also chime in on that one. Yeah, that's something that we've had to recently deal with the fires that were, raging throughout the state. It really was something that I think caught a lot of people off guard. We were not prepared. We've seen these wildfires in previous years, but nothing this close to the urban areas, to the city. And we actually had people evacuating, just right outside of Portland in communities. And so it was definitely something, another challenge that we had to deal with in the industry. There's nothing that mandates the job sites had to shut down, but I think a lot of the contractors just took it upon themselves to do the right thing and shut down the project. And I'm assuming that was also in coordination with the developers and the owners of the projects, that it was a safe thing to do. Not all of them. I did see a handful of jobs that I drove by that were still open and workers were out there, and I didn't recognize any of the contractors, so I can't say those were our members. And most of the contractors that I saw on some of these jobs were unrepresented workers, and it was really sad to see that they were out there working in these conditions. The air quality index was well above 500 in some of these places. I even heard reports of it being as high as 600. So it was really dangerous out there. And for anybody that wanted to continue working, it was just greed. It was shame on them. And I think we need to do something in the future to protect workers. It's a tough situation. Our members don't get paid when they're at home. They had to sit home for that week and they didn't earn any income. So that's the other side of the coin, is how do we balance that out? How do we keep them safe and keep them home but compensated somehow? So yeah, I think you saw for the most part a lot of the projects in the state were shut down where the air quality was above 200.
Absolutely. And I guess, Avery, did you want to weigh in on that one as well? Any thoughts on the handling of the fires, the impact on construction workers?
Yeah, so I have kind of a funny view on this because I am in consultation, but I do work for OSHA. So we didn't technically have a lot of jurisdiction when it came to the fires. Yes, it's hazardous, but it's way below our PELs. So employers that did want to work and were able to do it safely, they were allowed to do that in Oregon. But as a consultant, I strongly advise people not to work when it's hazardous outside, or when it's above. I think the level was 200. That they're not supposed to be working outside. There is some people do need to work and had half masks, and that was acceptable as long as they had everything done for the half mask. So, they had a medical eval, for instance. So anyways, so as far as OSHA is concerned, that wasn't something. So when Robert says people were still working, that was okay, but we don't advise that in any way. And in fact, we always referred people to Cal OSHA because Cal OSHA has some really good guidance on when people should work versus when people shouldn't on the air quality standards, based on the air quality standards.
Okay, got it. Thank you very much. Let's move on to the next question. have you encountered any jurisdictional issues responding to the COVID-19 pandemic? And if so, how have you addressed those? Let's send this one to Avery again.
Yeah, so Oregon OSHA doesn't always have jurisdiction, but we can usually find a government entity that does. We can usually find like OLCC, the federal government, places where we may not have jurisdiction. There's a process for Oregon OSHA to basically pass that off to another government entity so that everything can be addressed. So yeah, we have run into some jurisdictional issues. However, there's already a system in place for that.
Okay, thank you. And I don't know if Wayne or Robert or anyone else would want to weigh in on that.
Go ahead, Wayne.
Oh, I was just going to say, I think Avery answered it as perfect as can be.
Okay.
Yeah, I'll add to it. And again, we didn't experience any jurisdictional issues, at least on the surface. I don't know if anything was happening behind the scenes, but again, I think for the most part, everybody did a great job of putting all of that to the side and really focused on the issue here. And it was really positive, you know. There was just a lot of great ideas, a lot of talented people that are participating in our meetings. You know, we were meeting quite a bit, so communication. I think we were meeting 3 times a week when we first started virtually, and I think we quickly learned each other and developed that respect and established those boundaries. And I think that helped us moving forward and just kept everything really productive, and everybody was open to sharing ideas and resources. And so I didn't experience any of that, and I didn't see any jurisdictional issues from anybody, any agent, anybody.
Okay, got it. Thank you, Robert. I got several questions here for Avery. The first one is, since the pandemic began, has there been someone on the sites that are assigned for sanitation of the tools, or is tool disinfection being left up to each individual to take care of? What are your observations on that, Avery, from site to site?
So from each site, every site was different. Some sites, they left it up to they would have a procedure. Almost every single site that we saw had a procedure for sanitizing the job site as well as for tools. So sometimes it would be the general contractor would hire someone out, and sometimes it was the subs. So it just varied from site to site based on what they determined to do to make sure that things were sanitized. Oh, and there was one site where they had the employees, they had a sanitizing station right next to some of the equipment, and after they're going to use something, they sanitize it before they put it back.
Okay, very good. Okay, this is kind of a multi-part question, but it says, I'm working with a inside electrical contractor, and they've had issues with their employee safety goggles fogging up when wearing face coverings. Any suggestions regarding proper fit, anti-fogging options, use of face shields, or other types of alternatives to deal with this issue of fogging of safety glasses or safety goggles?
Yeah, so we heard this on almost every site visit that they were having issues. So we got to see some of the solutions as well. One solution for the fogging of the glasses is to put a piece of tape above or on the face covering where your nose is at or where the air is escaping, just to make it so that the air doesn't escape that area. Another solution is there are anti-fog glasses. I don't know if those are appropriate for electrical contractors, and the ones that we thought it worked really well, technically I'm not allowed to recommend them, but maybe we could bug Robert to recommend those later to the group. Face shields are definitely an alternative as well. I don't know if I don't know if they're asking if that's okay. It's okay in Oregon.
Okay, got it. Thank you very much. Anyone else want to weigh in on that?
Yeah, Scott, we did one of our visits out to Eastern Oregon. One of our members introduced us to a pair of glasses that were an anti-fog type of glass, and I can share that link to the name. It was a UVEX, but it was designed. The lens was actually had a separation, or there was separation between the lens and the frame, so it allowed the glasses to breathe when they were up against your forehead, and those things are almost impossible to fog up. So those worked really well, and that was something that a contractor had discovered out there and shared it with one of our task force members from Eastern Oregon. Jeremy Mondrell is one who introduced us to that. But those seem to work really well. A lot of us on the task force use those during our job site visits. So, yeah,
hey,
I recommend those.
Thank you. Appreciate that. Anyone else? Looks like in the chat there's a couple folks that have called in that had comments, and they said that one said that Barbasol shaving cream can be effective, and another one said that just washing the glasses with soap and water can create a film on them that makes it more difficult for them to fog up. Another question here has to do with the use of impermeable barriers on different job sites, and the question is, if you're using those and there's workers that are close to that, do they need to wear masks, or if you have an impermeable barrier near you when you're working, are you able to take your mask off?
Yeah, this is an example of something that's constantly changing. And one of the pictures as a better practice, you saw that there was a barrier instead of masks. Well, that was before masks, if you're closer than 6 feet, was implemented. I don't believe, no, I'm going to be perfectly honest, I don't believe they're allowing that anymore. I know in general industry they are not allowing that. You have to wear a mask as well as have a barrier. A barrier is a good practice, but it's the mask is a requirement when dealing with the public. So for construction, I believe that they are, I believe that is no longer appropriate. I think they still have to wear a mask if they're closer than 6 feet.
Okay, very good. Thank you for that answer. And we'll turn to Robert now. And this question is about workers coming in from neighboring states, particularly if they're coming from a hot spot where there's, an outbreak of COVID. How do you address that on the job site?
Scott, that was a question that we struggled with. That was an issue. We have wind farms out here in Oregon that are being built right now as we speak, and there was one site that most of the workforce that was coming up was from Texas, and it was right around the 4th of July, and we had no relationship with any of the contractors that had been brought in to do that work, and it was a concern being out in rural Oregon, small community, and then we had, I had heard that workers were had gone home for the holidays and then came back. There might have been an outbreak, and again, I don't have any evidence, but that was a concern. There was nothing in place that required those workers to quarantine, and I think that was something that we got a large project here in Oregon, and we're seeing a lot of our own local unions having to rely on some of our neighboring states to bring in a workforce to fill some of those calls. So it was just trying to find some balance there was difficult, and I don't know that we ever got a fix for it, but I think one of the things that seemed to work for us was that most of the local unions have a record of who comes through their local union to get dispatched on these job sites. So for us, that was a form of contact tracing naturally. We know where these workers were coming from, but then we get these sites throughout rural parts of Oregon where we have no idea where these workers have been, where they're coming from, where they're staying. And so that's something that I think we're still looking at to see how do we, get a handle on that, whether they quarantine or they have to, test. But I don't think there was anything in place. I don't think there's anything in place still that requires those workers coming in from Texas or Oklahoma or some of these other states that we're seeing workers come up here to work on these wind farms. So that's still an issue for us.
Got it. Thank you, Robert. And we're going to try to wrap things up here. We're in the last few minutes, but a couple more questions for Robert. So they'll have to be fairly short answers. But first question, can a general contractor force the employees of a subcontractor to undergo temperature testing?
You know, I don't know if it's forcing them, but I think most people were willing to comply with it. We did push back. We didn't feel comfortable with our own folks, folks from the trades checking each other's temperature. And so I think for the most part in this area, most of the contractors did a really good job of bringing in a third party with medical experience or training to perform those tests. And I think that was okay for most of the folks that I interact with and I represent.
Okay, and then we'll wrap it up with one last question. This has to do with the trade unions, and the question is, how are the trade unions responding to unionized workers being sent home with suspected cases of COVID-19? Again, for Robert. That'll be our last question.
You know, it hasn't been an issue. We didn't, again, there wasn't a lot of resistance. I think everybody has been really good about cooperating and respecting that and keeping the job sites open and keeping their peers and the people that are on the job site safe. So it really hasn't been a huge issue.